It was a project called Diverse Voices, and the aim was to explore why there is underrepresentation by people from ethnic minority backgrounds in health research. And the idea really grew out of my own experience, where I'd researched topics including diabetes self-management, and we know that diabetes is a condition that disproportionately affects people, particularly from South Asian backgrounds, but a lot of the research that's done doesn't include their voices and is not well represented by those communities. So I was really interested in that.
So with the Diverse Voices project, we asked participants about health research, but in a very participatory way. And both Shoba and I came up with photography as a tool of engagement.
Well, I initially just thought it was going to be one of those health research projects where we would be on Zoom and we would just be relating our experiences and just listening, and that was it. But actually, we were interacting with one another, and everybody was very open, and so everybody opened up and engaged immediately, not just because of the personalities of the people, but really because we started to understand what they wanted, and also that they were open to hearing from us and hearing about our creative experiences.
Most of my work involves photographing people. So obviously when COVID hit and then we've had the lockdowns, all work dropped off. So it's kind of really hard time for me personally as well. The only thing I did do was kind of pick up my old camera. I went out with that and I shared some of those photographs with the participants. So we used those as not so much inspiration, but look, this is what I'm doing, this is how I'm dealing with how COVID's affected me. Perhaps when you go out on your walks, perhaps these are some of the things that you could possibly look out for in your local area. So each of the participants would show their photos that they're taken on their phones, and then we'd all have a little kind of critique about what worked visually and what worked metaphorically in terms of what they were trying to communicate.
People came up with really, really wonderful photos, and the photos really did tell the stories that we thought that they might. For example, people took photos of their family members who they were carers for. They took photos of walks they were doing during lockdown, and that really helped then when it came to me introducing the discussions about barriers to health research. It really helped them to be able to open up more and speak from their own experience more, because we'd had that kind of connection and we knew each other's contexts and situations and kind of background experiences. So it made the conversations that I then facilitated about health research much easier.
The Diverse Voices project is very different to nearly, I'd say 98% of the stuff that I've done, and I've done it for different academic institutions. A lot of the time they're very good at listening. Sometimes they could be better at active listening, but really you do feel a bit spent and as though you're being used. So people want your experiences and your insights, but they're not really willing to give you something back. Essentially, they just think that a voucher or payment is giving you something back. That's part of the transaction. This project, obviously they did give us a financial incentive, but really it was about being creative, listening to us, trying to find out about our experiences of health in a much deeper way, and also for us to learn and to grow and to work in a team and work as a group. And I definitely went on a creative journey. So I am quite mouthy, but I never felt confident in expressing myself vocally, but also creatively. And I never wanted to share my experiences about being a carer, because who wants to do that? But also, I always thought that nobody was interested. And I never shared any of my creative work because I was scared of doing that, because it's exposing yourself, you become quite vulnerable. And because everybody was so open in that group, so Shoba and Kois and then our other participants, it just allowed me to do that, and it liberated me. And I've never felt like that in any other project before that and since.
As a consequence of the project, I've been able to share it widely with my colleagues at UCL and outside of UCL. And more importantly, many, if not all of the group have become involved in research as a consequence of the project, if they hadn't before. So it's allowed us to talk about that issue of research participation, but it's also allowed a means of giving the group access to becoming more involved in health research as well. So that the impacts have been really nice to see, and kind of I think everyone hopefully has benefited from it, not just me leading the project.